Welcome to the Down Low on Down There, where we peel back the layers on topics happening below the belt during midlife and beyond. I'm your host, Alex, and today we're diving into an often misunderstood topic: vaginal health during perimenopause and menopause. This episode is all about normalizing conversations around our bodies at this stage of life. Because let's face it, who doesn't have questions about this, right? Absolutely, Alex. Many of us have Googled things like, is this normal in regard to dryness, itchiness, urge to urinate, or discomfort during intimacy? Joining me today is Dr. Jamie, a renowned gynecologist specializing in women's health, especially for those navigating midlife changes. Dr. Jamie, can you tell us what changes we might expect as hormones begin to shift?
Right, Alex. As estrogen levels begin to decline, typically during perimenopause, many women experience changes that can feel quite uncomfortable. The tissue in the vulva and vagina can become thinner, drier, and more easily irritated. This clustering of symptoms is now referred to by doctors as genitourinary syndrome of menopause, or GSM for short. It's a spectrum that can include vaginal dryness, itchiness, painful intercourse, and even urinary issues. Despite how common these symptoms are, many women feel embarrassed discussing them or assume they're just a part of aging.
That's so important for listeners to understand. If half of postmenopausal women are experiencing GSM and many just suffer in silence, it reinforces how crucial it is to talk about these changes openly. What good news do you have for those experiencing these changes?
The encouraging news is that these changes are not something to simply accept as the way things are. There are options available. Many treatments can help alleviate discomfort and restore quality of life. Women deserve to feel comfortable and enjoy pleasure at any age. Simple adjustments and professional support can make all the difference.
Let's chat about one practical step women can take, focusing on their pelvic floor. This group of muscles supports the vagina, bladder, and bowel. What happens when these muscles begin to weaken?
When the pelvic floor weakens, the risk of incontinence, urinary leakage when you laugh, sneeze, or exercise increases. Additionally, it raises the likelihood of pelvic organ prolapse, where pelvic organs can sag downward. Engaging in targeted pelvic floor exercises can greatly improve these conditions. It's one of the simplest ways to support vaginal and bladder health, and I always recommend working with a pelvic health physiotherapist for guidance.
That's fantastic advice, Dr. Jamie. Just a few minutes of these exercises each day can make a difference. What about the vaginal microbiome, which sounds intricate yet fascinating?
The vaginal microbiome is such a delicate ecosystem. It consists of bacteria that play crucial roles in maintaining health. An ideal environment is slightly acidic, which helps protect against infections such as yeast infections and bacterial vaginosis. Hormonal changes, stress, antibiotics, and even personal hygiene products can disrupt this balance. To support our microbiome, it's best to avoid douching or using perfumed feminine hygiene products. The vagina is self-cleaning, and gentle washing with warm water is typically all that's needed.
Skipping those harsh products sounds like a great step. Are there specific foods or supplements that could assist with maintaining a healthy balance?
Yes. While certain foods rich in probiotics such as yogurt can help maintain vaginal flora, discussions around vaginal probiotics containing lactobacillus strains with a healthcare provider could be beneficial as well. They can aid in balancing the microbiome, especially if someone is experiencing recurrent issues.
Super helpful. Now let's talk about a topic that often feels taboo: sex and intimacy in midlife. Many women might find that declining estrogen can lead to vaginal dryness or discomfort during sex.
That's right, and it's a conversation that needs to happen more often. Vaginal dryness can lead to micro tears, and while it may seem uncomfortable, it also makes women more susceptible to infections. A good quality pH-balanced lubricant can greatly help with this, making sex more pleasurable again. Water-based lubricants are safe to use with condoms and most toys, and many experts recommend vaginal moisturizers for regular use beyond just sexual encounters.
What about the role of sex toys in enhancing pleasure and reconnecting with desire during this time?
Sex toys, especially vibrators, can be powerful allies in enhancing sexual satisfaction. Studies suggest that using vibrators is linked with improved sexual satisfaction and vaginal health among midlife women. It's all about rediscovering pleasure and what feels good to each individual.
Speaking of individual needs, let's touch on hormones and treatments. If a woman is experiencing persistent dryness or urinary issues, what are her options?
For those women, topical vaginal estrogen or DHEA prescribed by a doctor can restore moisture and elasticity with very low systemic absorption. These treatments, which come in forms like creams, tablets, or rings, can be excellent first-line therapies for addressing GSM.
That's great to hear. And while we often think pregnancy isn't a concern anymore, sexually transmitted infections still are. Can you touch on the importance of regular screenings?
Absolutely. Using condoms remains essential to reduce the risk of STIs, especially with new or multiple partners. Women should schedule regular STI screenings every 6 to 12 months or sooner if they notice any unusual discharge, bleeding, or discomfort. It's about prioritizing their health, just like with any other part of the body.
As we wrap up, let's give our listeners a healthy vagina checklist. What steps should women keep in mind?
Definitely. Here's a quick checklist inspired by experts in vaginal health. Wear breathable cotton underwear. Change out of sweaty clothes promptly to avoid irritation. And avoid harsh detergents and fabric softeners that can trap moisture. Always wipe from front to back to reduce infection risk, and regularly book checkups with your GP or gynecologist. Remember, there's no symptom too small or embarrassing when it comes to your health.
Thank you so much, Dr. Jamie. This has been an enlightening conversation. I hope our listeners feel more informed and empowered to initiate these important discussions with their healthcare providers and loved ones.
Thank you for having me, Alex. Remember, caring for your vaginal health is caring for your whole self. Let's keep this conversation going.
Thank you for tuning in to the Down Low on Down There. If today's episode helped you feel more informed or less alone, please share it with a friend. Remember, the journey of midlife is a shared experience, and we can support one another through these changes. Until next time, take care and embrace your journey.